Joining us now is the health officer for Anne Arundel County, Tony Getting. Good to see you again.
Good to see you.
You're getting into the violence interruption business. We just had Safe Streets on over with LifeBridge, and I'm curious, how will this look in Anne Arundel County? What are your expectations?
Yeah, so we're working with a community-based organization to really implement this program. So the role of the health department here is to look at the data, determine where we really need programs like this, and then find the right community-based partner to implement the program. And so for us, we're going to be in Annapolis and Eastport.
Okay.
And we are going to be partnering with Kingdom Care, which is a nonprofit in the area. They're also working with a smaller nonprofit to really focus in on Annapolis,
Okay.
And hiring people from that community that are well known in the community and potentially have backgrounds that lend them as credible messengers and voices to the community.
And I'm guessing there has to be a sort of an element of trust as you choose folks to get in there, and I guess trust from the community to say, I'm going to let someone in the community and they're going to help us out, because that's not easy to do.
It's not, and that's why we really want to work with a community-based organization that is known to folks and that has those connections to hire the right people to say, you know what, I think X, Y, and Z would be wonderful for this program. People know them, people trust them, they are doing the right things with their life, and they want to make an impact in the community that they come from. And so making sure that you're picking those individuals is incredibly important for folks to trust you to talk about,
Sure.
you know, things that they're doing, conflicts they might be having with others. That's important.
We see your press releases. I mean, your docket is full, whether you're going to schools with dentistry or if you're out there with wildlife. I'm wondering where crime prevention fits in there, and why was it important for the health department to take it on?
Yeah, so we see gun violence as a public health issue, and we
Okay.
see it that way for a couple of reasons. The things that lead to violence in communities tend to be the same things that are social determinants of health. And so how do we get in and understand where it's happening, what the patterns of transmission are, similar that we might do with a disease process.
Okay.
And for us, because it's like the leading cause of death in children in the country and in the state of Maryland, it is a public health issue. It's a health issue both mentally and physically, the impacts of gun violence for not only the impacted individual, but the community and their families long term.
And the stat is incredible, especially when it comes to young people, to see that number be so high. Is that why Eastport became the spot that you wanted to focus in on?
Yeah, so we did see in Eastport that we had a good number of victims that were under 25
Man.
and also children. And so we look back over the last 2 years at the amount of gun violence. We have wonderful partners with police force to tell us, you know, here's what's happening and where it's happening, so that we can really map where violence is taking place. And so that was why Eastport was one of the communities we looked at in Annapolis.
Sure.
There were a few others that also experienced gun violence, but they had some of the higher rates in the city of Annapolis.
You also have your eyes on Glen Burnie a little bit, because I feel like you're saying youth have an issue there.
Yeah.
You want to keep an eye on that crime there as well.
We do, and so for us, it's understanding what's happening in the entire county and where different pockets of gun violence might be happening and where it's more prevalent. And so we've also seen in the northern part of the county, Brooklyn Park, Glen Burnie, that's an area, and we're going to be starting a new planning grant focusing with youth and to determine what we can do and what we should be doing in North County as it relates to gun violence.
You had a tough sell not that long ago, and it came to gun locks, and you went to libraries. I mean, for some people, that might be the place they think of least. Why was that important to have that gun lock program, and they're free for folks?
They are free. That was really important to make it low barrier for residents to go out and get a gun lock, to also make it in a place where there are 16 branches across the county, right? So it may be easier for you to get to a library than many other locations. Also, you know, everybody goes to the library for all sorts of different reasons, and knowing that there might not be stigma to walking in there and asking for a gun lock. And it's been incredibly popular. We've given out over 4,000 gun locks across the county. Also partnering with other institutions to give out gun locks. So we have started doing with our Healthy Start program when they're doing home visits with parents. It's a really simple, if there's a firearm in the home, would you like a gun lock if it's unsecured? And we've seen really great reception, and also working with community partners, giving them away at health fairs and other community events. And so we're really excited to do that. We're expanding our partnership also with DSS. And so, yeah, giving out gun locks in as many places as we can to make sure if you have a firearm that you're keeping it safe and secured.
And if people want to learn about that and also about violence prevention, I'm guessing your website is The Stop to Make?
Our website is The Stop to Make.
Okay.
You can go to AA Health, and that's where you can find us.
Excellent. Tony Getting, good to see you.
Good to see you too, Jason.
Appreciate it.